Hi, everybody. Welcome to today's live discussion on PECS, or Picture Exchange Communication System, and language development. My name is Marcy Melzer, and I am an intuitive speech and language pathologist, and I help parents teach their children how to use words naturally to share their wisdom with the world. And today's discussion is all about the Picture Exchange Communication System, or PECS. So I see Helen and Justin and Anita are here. Thanks so much for joining me today on this live. If you have any questions or comments during the video, go ahead and put them in the comments, and I'll see if I can hit them while I'm going. But I do have some visual aids set up and ready to go ahead with this discussion. So let's get started. We're going to start right away with, what is PECS? Okay? And PECS is Picture Exchange Communication System, and that's what it stands for, Picture Exchange Communication System. So if you've ever heard about that method, or you've seen it presented and you have heard it referred to as PECS, that's what it stands for. All right, so PECS was invented in 1985 by Andy Bondi, PhD, and Lori Frost, a speech language pathologist. And these names at the bottom, Skinner and Lovaas, Skinner is a behavior guru, you know, from the very beginning, from long years ago. And PECS was based on the work of Skinner, who is a verbal behavioralist, and Lovaas, who invented the applied behavior analysis method for working with kids. So PECS was developed from the philosophies of these two behavior interventionists, and that's where PECS comes from. Now, I went ahead and researched, so I made sure I was completely accurate in describing it. And so from even the PECS website, this is what the primary goal is of PECS. So what we're going to do is now we're going to talk about basically what it is. What is PECS? It's stuck to my thing right here. What is it? The primary goal of it is to teach functional communication. So let's make that really clear. The purpose of PECS is not to teach verbal talking. It is to teach functional communication, just so that you're aware and you know that for sure. And PECS is actually the #1 recommended intervention for ASD, or autistic spectrum disorder. And the #1 recommended intervention for kids, especially nonverbal kids who are diagnosed with autistic spectrum disorder, is ABA and PECS. And so here's what we're going to talk about next. Why is PECS recommended? Like, why is it the #1 recommended intervention method for kids with ASD? And that's because, ASD, or autistic spectrum disorder kids, end up with limited functional skills, okay? And then I'm just going to pull the next card out and tell you that ABA and PECS for speech therapy work towards functional goals, okay? So this is the reason that it's most often chosen, ABA and PECS, because these two methods work on functional goals, and kids with autistic spectrum disorder have limited functional goals, certainly limited communication. Okay, now the reason that they choose those practices, ABA and PECS, is because not only do they work towards functional goals, but they are also what's called evidence-based practice. Now, evidence-based, evidence is, what do we have for real that shows improvement when you work with a method? And in this case, the evidence in the evidence-based for these methodologies is data, okay? And PECS and ABA are two systems that generate lots and lots and lots of data, okay? And that's where the evidence-based part comes from when they talk about how ABA and PECS are evidence-based methodologies to work with kids. So that's why we know what PECS is and why it's most commonly chosen for kids, especially on the spectrum. Not necessarily, because even the people on the PECS page talk about that because PECS as a system goal is to develop functional communication. The people who promote it say that it works for anyone who is not using any kind of verbal communication as a method to teach them a way to communicate functionally. And that's what it does. Okay, so actually that's what we're going to talk about right now, is what does PECS teach and how? Okay, so how does PECS teach functional communication as its goal? Its primary goal, like we said, is to teach functional communication. That means communication that we need to use for real things, okay? Now, how PECS works is it actually moves through phases. There are 6 phases in the PECS system, and the first phase is to teach kids, literally, this is what it says, how to communicate. So when we look at what does PECS teach, it teaches children a method, because it is a system, an exchange system, that teaches children how to functionally communicate, okay? And here's the caveat, with pictures, okay? Because it's a picture exchange system, it teaches children how to communicate with pictures. All right, that's phase 1. And how that works in PECS is that a child is encouraged to give a picture to someone in response to get what they ask for. So if there is a banana on the table, the child gives a picture of a banana, they get the banana. Okay, so that's what is phase 1 of PECS. Now phase 2 of PECS is what's called distance and persistence. So that moves into the using of the pictures. So not only is it just teaching kids that pictures are representing objects, basically the picture of the banana means banana, but also teaching them that they can use that picture of a banana to get a banana, not just from that one therapist who taught them that skill, but they can use that picture of a banana to get a banana from anybody who has a banana, who is willing to give it to them. So if they ask their mom for a banana with a picture, and that's usually what happens at that stage as far as working with parents at home, is to get you to use a bunch of pictures and have your child hand you the picture before you hand them the banana. Okay, so that's step 2, is that they start to working with pictures in all different kinds of places, not just in the therapy session, okay? And then they move into phase 3 in TeachingPECS, and that is where the child is taught to select from 2 or more pictures, okay? So then if you have 2 pictures, or you have ultimately a page full of pictures of food, the child picks the food that they request, hand it to you as the parent or whoever they're communicating, their communication partner, as they call it. They hand them the picture, and then they get whatever it is that they've chosen, provided that choice is available. And then, so that is phase 3. And then phase 4 has 2 steps. So that's where they move into using sentences, okay? So that's where the pictures then move into a sentence to make it sound more like a whole request. So instead of just using the word to say, banana, to get a banana, now they're going to use a sentence that is usually scripted out ahead, like I want a, with a phrase at the end. So it says, I want a banana, or I want a whatever. And sometimes they flip out those words, like I see a, whatever. But actually at this step, at stage 4, is really just requesting still. So I've jumped ahead. Actually, phase 4 is requesting with a sentence that is scripted ahead, and then that picture that they learned in the first 3 phases, they put at the end of that sentence. So first they learn that sentence, I want a, and then they put their picture at the end. Okay, and now then the phase 4 actually moves into a next more expanded phrase, where the child learns to expand the sentence by adding attributes, like adjectives. So instead of I want ball, I want the blue ball. Or I want sucker, instead of I want lollipop, it's I want blue lollipop, or I want yellow lollipop, or I want apple juice versus orange juice, you know, when there's a choice around like that, to be able to use more specifically to teach them a way to communicate more accurately what exactly they want using pictures. Or that's when they move into the strip, where the first 3 words might be printed out, or there might be a picture for I, a picture for want, or you know, something like that, and a picture for the place in the sentence for the color, where they could put the blue or the yellow, and then the ball. And so the child then will use all the pictures and put them on the strips to say the picture for I, the picture for want, the picture for blue, and the picture for ball. And then they take that whole sentence strip and hand you the string of sentences, the string of pictures that makes up a sentence. So that's how the PECS system teaches children to use a sentence to request a picture sentence, a picture replicated sentence, to request, and expand that to requesting very specific things. So that's the phase 4. And then they move into phase 5, which is the answer question phase. What do you want? So instead of having to make a choice for all of those things, or script a sentence, the child can answer someone if they say, what do you want, by going to their vocabulary book, iPad, tablet, whatever, and handing you or indicating the picture, pointing to the picture of the thing that they want in response to your question. And that's where it moves into more functional use, is when you ask the question, then you get a picture as a response, or a stripped sentence as a response. So the question is usually, what do you want? At phase 5 specifically, it's the answer to this question, what do you want, using a word or a sentence. That's phase 5. And then the final phase for PECS is phase 6, and that's where they teach kids to answer other questions, but other what do you questions. So I took this straight off the website. It says, you know, what do you, and then the answers like, what do you feel, what do you hear, what do you see, you know, those questions. And then you can use your phrase strip or sentence or picture, then they'll learn the vocabulary for happy, sad, you know, scared, things like that, so that when the child is asked a question, what do you, how do you feel, or whatever, then they can use a picture to represent their response. So that's phase 6, okay? So that basically, all of that, phase 1 through phase 6, has taught children functional communication with pictures. So you understand right now that the picture exchange communication system is a functional system to teach children how to use pictures to communicate functionally. Okay, so now comes the bigger questions, and that is, how do speech therapists use this PECS system to teach kids to actually say words? Because if most children who are in an ABA kind of school, if they're, you know, using ABA, or if their speech therapist is using PECS as a method toward teaching them verbal language, here is how that works, okay? And this is how I was trained as a speech pathologist, to use this methodology with children who are on the autism spectrum. But any child, those were the only children who it was indicated for at the time. That was when I was working in a school district in Clark County, Nevada, in Las Vegas area, and in Las Vegas actually, and we were using the PECS system exclusively as a district to teach children to move into verbal communication. So instead of just using the pictures that was happening in their ABA sessions, we as speech therapists were learning how to use this method to teach kids verbal language. So if your child is receiving ABA therapy and speech therapy, like at the same ABA center, this is how therapists, your speech therapists, are working with the PECS system, okay? So Any speech therapist is going to be looking at a child from communication with these stages, okay? Now, ABA therapy can work on all kinds. It's applied behavior analysis therapy, so it works on behaviors. It works on attention. It works on aggressive behaviors, behaviors you want to extinguish, all of that. As far as the communication portion, the PECS system is the way to behaviorally teach kids to use words, okay? So the speech therapists that are working with the therapist using their own speech therapy, like I said, me as a trained speech pathologist, I used these stages of development with every child who's nonverbal to get them started. So first it has to start with this joint attention, which means that you're actually working on the same activity at the same time, and kids have to have joint attention to be able to participate in therapy at all, okay? So they have to have joint attention. And then we work on receptive language so that a child can understand. You have to be able to understand a language before you can be able to say it. And then we work on developing the expressive system, which, depending on the child, is the system that we as a speech pathologist choose to help facilitate language with. And again, like I said, when PECS was the option of choice, that was what I was directed to use with these children, you know, this is how we went about it. So understanding my own, you know, knowing about how language develops, you have to go through it this way. So the PECS part actually teaches the vocabulary, that receptive language. It also teaches the child to be able to engage and interact together because you're both focusing on a picture. So again, joint attention, if you hand me the picture, that's teaching us to communicate together and to actually learn the vocabulary that's on those pictures. So PECS helps speech pathologists teach kids joint attention and receptive vocabulary because they're learning what all those pictures say. Because someone is saying the words, it's just not the child. It's the therapist who's always saying them. So the child is listening to the words and they are taught to match the vocabulary to the objects and match the vocabulary to the pictures, things like that. That's how it works, that they evolve. So the speech therapist part actually is responsible for teaching comprehension and use. So while the PECS, even the teachers who are working with the picture exchange part, just to actually hand a picture to, it doesn't take a speech therapist to do that. Any person, that's why parents can do it, to teach a child to hand you a picture. All right, so, and the thing about speech therapy, in addition to any therapy at all, especially if it is in any kind of a system where there's reimbursement involved, is once again they have to be evidence-based. And what it means is that the goals have to be measurable. We have to measure the goals of speech therapy just like we measure the goals of ABA. And that's how we do that, by making goals that are measurable. And so what we do is we pretty much pick apart every behavior, communication behavior we want a child to perform, whether it's a joint attention behavior, a receptive language behavior, or an expressive language behavior. All of those behaviors have to be quantifiable, countable, and measurable in order for your therapy to be evidence-based, according to people who need data to prove that evidence. And so I'm going to give you some examples of the goals that a speech therapist will use, those measurable goals, to move a child through the progression of PECS to work on verbal language. So the first goal they're going to do is that T, that's a child's name for pretend, T, test child, will match pictures with a model 80%. So, and I say that with a model because in order to get a child to know how to match pictures, you have to show them how to do it. Just like in order to get them to, you know, put something in the trash, you have to show them how. And that's how behavior training works. First, you have to show the child the behavior you want, and then they imitate that behavior from you until they get good at it and use it on their own. So it's all about imitation. And so in order for, like I said, the first joint attention goal is going to be that a child's going to match pictures. So now are they learning the pictures what they are, but they're actually matching them. And then that 80% is usually the magic number for children who are young. Once they do something 80% of the time, then they usually have that skill integrated, and then you can move to the next skill, and that's how the evidence-based stuff works. So once a child can match words, now the other thing that I want to tell you about is this goal gets worked on until the child is 80% accurate out of a certain number of productions. So it's not just 80% of the time, it's 80% out of 8 out of 10 utterances, or 80% when in the therapy room, or 80, because it has to be so measurable that you can't doubt the data. So the goals have to be very, very specific. And a speech therapist will work on that one goal. They only have to have one goal at a time to work on, and they can work on that goal until it's done. And so a child, if they're resistant to that one goal, they're going to work on that goal for a long time, months even, just to match the pictures, because they can't move forward in evidence-based work until they've met the first goal, because the goals are designed to build on each other like those phases in the PECS system, okay? So then here's the next goal, the receptive language goal. And that's like T, test child will identify objects or pictures when spoken. So someone else says, where's the blank, or find the banana, when there's a banana and an apple and an orange on the table, or there's a banana and a shoe, they say find banana, you know, after they know what it is, okay? The next goal moving forward is that it's still a nonverbal goal. Test child will use pictures to request 80% of the time. So that's what the speech therapist is going to do, is to actually facilitate using those books, where the ABA therapy might work on some of the other behavior skills, sitting in the table, identifying the vocabulary, things like that. The next goal to move forward, remember, we're working on comprehension and use as a speech therapist, and we're using this picture system to communicate words. So that's how it's going to be, is that the child will use those words. Now this goal can take a long, long time to get, because it's not just pictures to request one thing, because once a child can request one thing, then the therapist has to work on getting the child to request more things. So they request one thing 80%, then they request foods 80%, then they request clothes 80%, then they request you know, activities 80%, things like that. So that single word requesting, just by handing a picture to you, that goal can go on for months, or in a school situation a whole year or more, even more than a year, just to use those single words, because kids don't get consistent with it. But when they do get consistent with using single words, then the next step that actually works towards talking, okay? So now we've worked for potentially years with nonverbal communication using PECS, but as a speech therapist, you still have to follow the evidence-based and following the system when you follow it in its way. But then once a child does show interest in starting to say words, and they're really good at imitating the nonverbal kinds of behaviors you're doing, the matching, the handing you, things like that, then the therapist will try to get the child to imitate and say. Remember, imitate means say with a model, the single words, when presented with a picture. And that's where the flashcards come in, where we learn all the foods. And then, you know, so you go through 50 flashcards, and the child identifies 47 out of 50, or whatever 80% of that is, so that, you know, when you're looking at, and that's going to help build those vocabulary. And when the child says the word, so then it's like, say banana, say ball, say apple, say whatever. So the therapist says it and the child imitates it, and the therapist works really hard to get the child to imitate that verbal behavior. Once a child shows that they're good at imitating the nonverbal behavior. but the therapist is going to try to get that child as much as they can to imitate those words after them, to get them to practice saying them, because just like when you practice matching them, they get into your receptive vocabulary. When you practice saying them in, you know, labeling flashcards like that, that practices your verbal language. All right. And then the next goal is that the child will use a single word to request from a choice 80%. So just moving through the PECS system, the speech therapist is going to then use that question to say, what do you want? You know, or they'll have the whole book, and instead of using just the single word or imitating the single word, then the child will be requesting with a whole bunch and potentially imitating those single words verbally when they're requesting them. And then the next step is moving into those questions that the test child will answer the WH questions using a 3-word phrase or wherever the child is. Sometimes its child will answer the question with 1 word if they haven't moved up to the phrase level yet. So using questions to move through to answer those questions, to get kids to talk, is the next step that a speech therapist will use. And so that's how it evolves as a speech therapist, and it moves into the child. So if the child is always imitating what the pictures are teaching them, then they're always going to be imitating a single word or that scripted 3-word phrase, and that's how it's getting into their memory bank, so that later when the child does want to go to use a phrase or something like that to request a word, then they're going to pull out of their memory bank that scripted phrase, just like when they were using single words, they pull out of their memory bank the single word that meant that picture that they learned in flashcards in speech therapy. Okay, sorry, nose is itching. Now, the next thing that we're going to talk about is, why is PECS challenging at home? Okay, so we know that it teaches, and we know that speech therapists do it, and most of the time speech therapists will tell families to start to use these systems at home, or the ABA therapist will come to the house to teach a thing using the PECS books and the PECS boards like that. But often parents tell me that it's a big challenge for them to get to use these picture systems at home, and they're leaving the books at school. You know, their kids are, they're working great because they're moving through these goals with the therapist, but the child still isn't using either the pictures or the single words to communicate with you at home. And in school, they're doing it, you know, every quarter you get your quarterly notes and you can see the percentages moving up. Maybe they're not at 80% yet, but they used to be at 20%, you know, like they didn't do it at all. And now they're doing it 50%, which shows progress. But still at home, they're not using the pictures and they're not saying words. And so the deal is, you know, the question that most parents have for me or their therapist is, why is it challenging? Why is it hard to work on PECS systems in the house? And here's a few reasons why. The first reason is that late talkers invent their own system to use at home, and they teach you as parents how to do it. They show you what they want. They get things themselves. They learn how to climb on the cabinets. They, if you try to get them to talk, they just give up trying and quit on you. So the thing is, most late talkers who are already using some other system aren't necessarily keen on changing into using the system that you are trying to bring home from school, or all the pictures that you've laminated and put together. They don't have any interest in them. They eat them, they trash them, they rip them up. You know, they're not using them to communicate at home, or the other kids in your family are playing with them. I just talked to a mom like that's happening today. Like, they can't even have the book at home because their other kids are tearing them up and playing with them, and they're not even using them because they have to be handy and accessible for them to use. They can't be put away in a cabinet somewhere if your child needs to have them accessible, and then the other kids are just playing with them and messing with them, and so they're not keeping them up or whatever. So that's another reason. But here's another one. So late talkers invent their own system, and then the kids expect their parents to know their needs. I mean, you know, late talkers just know, like I said, they've taught you already how to understand their nonverbal messages. They know, you know, you've learned how to anticipate their needs. Maybe you've learned that they're always hungry. They always want a certain thing when they do a certain behavior. They point to the cabinet. They always want that certain thing. So you just know that, and kids expect you to know it. They've taught you. That's your job as parents, is to know what they want. And suddenly when you pretend you don't, or you make it hard for them to communicate that, or you change their way to do it, they just don't like it. They just don't like it. And so that's why they don't do it. And here's another reason, is that using pictures for kids isn't natural, like gestures. You know, it's just as easy to just show me. And I think that that's what happens to parents too. Like they're already busy. Their child is wanting something. They don't know what their child wants. Rather than go through the rigmarole of trying to look through the pictures to identify what it is or whatever, they just rely back on, just show me. Just show me what it is, and and then I'll get it for you. And it always falls back on that, because the PECS system isn't natural. It's not handy. It's not perfect. It doesn't tell you all the words you need. You're limited always to what's on the page. And as much as you can guess and anticipate everything a child can possibly want, there's no way possible you can have all of that available to them on a picture system. There just isn't, okay? And so, because that's the other reason that the pictures are not easily accessible. And all that work that you've gone to laminate, cut, and put Velcro on stuff and attach it to things and develop these systems and books and stuff, you know, if you leave it in the car and you're in the house and your child's having a meltdown, that's not helpful. If you leave it at home and the child doesn't have it at school to be able to communicate the things that they want with their friends, then that's not helpful. And that's why often PECS systems don't work at home. Is because they're just not easy. So here's the thing, what can you do instead? What can you do instead of using a PECS system in your home to teach your child how to use language naturally? Basically, you can use your therapist as a resource, because the best language facilitator is you. So if you become your child's language facilitator, you can use your therapist as a resource. Have them, your speech therapist, teach you the kinds of ways that they are working with their kids to get them to imitate words. Or you can become a language facilitator yourself and get a customized plan and learn how to teach your child to use words naturally all the time. And I'll give you a hint. It's not by prompting them into using a picture exchange, because anytime you rely on a prompt, even a picture or a question or a make your child say something, try to pull words out of them, you're always teaching them that the way to talk, like I said, the PECS Facilitator teaches kids how to communicate using pictures. Your child's teaching you how to communicate using gestures and nonverbal communication. The only way to teach your child how to communicate naturally in your home is to use natural language facilitation. And if you want to know more about how to do that, you can check out all the videos on my YouTube channel. There are 50+ videos on there about language facilitation. Or I have a free class on my website, wavesofcommunication.com, which teaches you exactly about what language facilitation is and why it works, why it's the only thing that can help your child overcome their resistance to using words. No matter what that resistance is, if your child is able to produce sounds and words, you as a parent can teach them to use language naturally using language facilitation. And if you want to know more about that, you can check out my website at wavesofcommunication.com. So I hope that this video was helpful for you to teach you more about language facilitation and to teach you about what PECS is and what it actually teaches your child and why you might want to consider or reconsider language facilitation as an alternative to this #1 recommended method. Is language facilitation evidence-based? No, not so much in that it's data-driven, but is waves of communication evidence-based in that families are using it and it's working? Absolutely. That kind of evidence is identified as families videotape their own kids every week and see improvement in their natural language communication. They start to talk about their environment, and none of it is prompted. All of it is natural imitation that happens naturally with kids when parents do language facilitation. So if you want to know more about how to do that, check out my website. I promise you that it's a real thing. 20+ families now in the program have each seen new functional interaction and communication within the first week of using language facilitation. And many of these parents used PECS systems for months or years before they were able to teach their kids to use natural language within 3 to 6 weeks with waves of communication. So if you want to know more about that, check me out. Other than that, I'll see you next time for my next live discussion on language facilitation, and have a great weekend. Enjoy your summer and get out there teaching your kids how to use words naturally.